I'm Tilo Kölbel. I'm a vascular surgeon from the University Heart Center Hamburg, and I speak about aortic arch treatments at CIRSE 2018 in Lisbon. In 2018, we were able to treat all the segments of the aorta, including the ascending aorta and the aortic arch, with endovascular therapies. But it all depends on case selection, lesion type, and most of all on the availability of devices and the individual experience of the center and of the operator. Case selection is the key issue in selecting patients for endovascular arch repair. The patient that is eligible for this kind of repair is mainly a patient that has aortic arch disease, either aneurysm or dissection, but he needs to provide a sufficient landing zone in the ascending aorta, and furthermore, he best is not a good candidate for open techniques. So we look at usually patients that are in their 70s and 80s, or they have other severe comorbidities which don't allow them to be treated by open techniques. I'm convinced that we can broaden the indication for endovascular arch repair depending on what kind of devices we will have in our hands in the future. But it's not only the device, it's also the operators that gain experience with these techniques, and we will be able to take on more challenging anatomies and maybe also intermediate and low-risk patients in the future. We have been seeing surprisingly good outcomes, even though we recruited mainly patients of old age and with significant comorbidities. We've seen outcomes with mortality rates and stroke rates around 5%, which is competitive compared to open surgery, although open surgery is done on much younger and healthier patients. Currently, physicians who are doing these kinds of treatments usually are current edge endovascular operators that have a vast experience in using fenestrated and branched solutions in the thoracoabdominal area. But what you also need is a solid understanding of physiology of the heart valves, and of the aortic arch, as this is a different area to treat. So if somebody wants to go into that area, what is really needed is to become very familiar with the complex devices, generate a very good relationship with cardiac surgery, cardiology in the center, in order to set up such a program. What has been surprising to us is that despite all other improvements in treatment strategies, we have seen that in most studies the risk and percentage of stroke during TIVA treatment has remained the same, around 5%. When it comes to arch treatments, it's even higher. It is usually between 10 and 15%. So this is an area where we really need to learn significantly what causes the strokes and how can they be prevented in the future. What we are currently missing in understanding the downsides of TIVA and endovascular arch repair is what causes strokes. We are all grown up with the understanding that strokes are caused by catheter and wire manipulation, and that the wires and catheters embolize material from the aortic wall. What we learned recently is that air is a contributor. So what we really need to answer is what of these causes of stroke is the more important one, and how can we prevent that?